Bismillahirrahmanirrahim. Assalamu alaikum. Today, inshallah, we will cover a new topic which is the anatomy of the female reproductive system. First of all, I will tell you some of the components of the female reproductive system. See in the diagram, this is the uterus of the female reproductive system. The lower part of the uterus is called as the cervix, and the cervix project into the vagina. See here, this is the vagina, this is the cervix, and this is the uterus. Okay, on each side of the uterus we have two fallopian tubes, which are also called as the uterine tubes. Okay, at the lateral end of the fallopian tube there are two ovaries. So ovaries, fallopian tubes, uterus, cervix and vagina. These are the components of the female reproductive system. First of all, we will discuss the uterus. The uterus is the hollow pear-shaped organ with a thick muscular wall. See here in this diagram, this is the uterus, which is the hollow pear-shaped organ with three coverings. The outer covering is called as the perimetrium. The middle covering is called as the myometrium. It is the thick muscular wall, and the inner covering is the endometrium, which sheds every month and it forms again. So there is perimetrium, there is myometrium, and there is endometrium. In the young nulliparous adult, it measures about 3 inches long, 2 inches in width, and 1 inch thick. It divides into many parts. The parts are the fundus, the body, and the cervix. First of all, the fundus of the uterus. The fundus is the part of the uterus that lies above the entrance of the fallopian tube. See here, this is the entrance of the fallopian tube, where the fallopian tube is entering into the cavity of the uterus. So the part which is above the entrance of the fallopian tube is called as the fundus of the uterus. The body is the part of the uterus that lies below the entrance of the fallopian tube, and the cervix is the narrow part of the uterus. Okay, but the lower part of the body of the uterus is called as the isthmus. The isthmus will project into the cervix, and cervix will project into the vagina. So cervix is the narrow part of the uterus. The cavity of the uterine body is triangular in coronal section. The cavity of the cervix, which is called as the cervical canal, it communicates with the body of the uterus through the internal os. See here, this is the internal os through which the cervix of the uterus is communicated with the uterine cavity, and the cervix is projecting into the vagina, and it is opening in the vagina through one opening or os, which is called as the external os. Before the birth of the first child, the external os is circular in shape. So what we have learned in this slide, this is the cavity of the uterus. It is triangular in the coronal section. We have the cervix of the uterus. The cervix of the uterus has two openings. The internal opening is called as the internal os, and the external opening is called as the external os. Now, what is the position of the uterus? In majority of the cases, the long axis of the uterus is bent forward on the long axis of the vagina. This position is called as anteversion. Anteversion means the long axis of the uterus is bent forward or anteriorly on the long axis of the vagina. Okay, this is the normal position of the uterus, and it is called as the anteversion of the uterus. But sometimes what happens, the uterus of the body, it is bent more, or it bends acutely on the long axis of the vagina, and this is called as anti-flexed position. And sometimes what happens in 10 to 20% of the individuals, what happens, the uterus, the long axis of the uterus is bent backward or posteriorly on the long axis of the vagina, and this is called as retroversion. And when it is bent more, it is called as retroflexed. Okay, so there are 4 positions: anteversion, antiflex or antiflexion, retroversion and retroflexion. Now, what are peritoneal relations of the uterus? See here, anteriorly, when the peritoneum is coming from the anterior abdominal wall, it is reflected from the bladder to the isthmus of the uterus anteriorly. And here it forms one pouch, which is called as the utrovesical pouch. Okay, from the name, it implies that it is in between the uterus and the urinary bladder. The word vesicle means the urinary bladder. So this is a pouch which is in between the bladder and the uterus, and it is called as the utrovesical pouch. Okay, and behind, over the fundus and on the posterior aspect of the cervix and vagina, there is another pouch which is called as rectouterine pouch, because it is in between the rectum and the uterus. This rectouterine pouch is also called as the pouch of Douglas. So anteriorly there is one pouch which is the utrovesical pouch, and posteriorly there is one pouch which is rectouterine pouch. Now we will discuss some of the ligaments of the uterus. First of all, there is the broad ligament of the uterus. This is the broad ligament, which is the double fold of the peritoneum. It extends from the lateral pelvic wall. See here, this is the lateral pelvic wall to the side of the uterus. This is the broad ligament. The part by the side of the uterus is called as the mesometrium. Mesometrium is a part of the broad ligament, and the part which attaches the fallopian tube is called as the mesosalpinx, that is the mesentery of the fallopian tube. The word salpinx means the fallopian tube. So the mesentery of the fallopian tube is called as the mesosalpinx, and it is also the part of the broad ligament. Then we have mesoovarium, that is the mesentery around the ovary, and it is also the part of the broad ligament. Okay, so there are three mesenteries. One is mesometrium, one is mesoovarium, and one is mesosalpinx. These are the parts of the broad ligament. Number 2 is round ligament. Can you see here in this diagram? This is the round ligament of the uterus, and it is attached inferiorly to the entrance of the fallopian tube, and this maintains the anteversion position of the uterus. So this is very important. This is the round ligament. It is attached inferior to the opening of the fallopian tube, and it is attached to the lateral pelvic wall. Okay, so it will maintain the anteverted position of the uterus. Now there are some other ligaments which are uterosacral ligament. From the name it is clear that it is in between the uterus and the sacrum. It gives support to the uterus by its attachment on the sacrum. See here in this diagram, this is bladder, this is cervix, and there will be vagina, and this is the rectum. So here there will be ligaments which are attaching the uterus to the sacrum. These are called as uterosacral ligaments. Then there are cardinal ligaments. See here in this diagram, this is cardinal ligament. Cardinal ligament is also called as lateral cervical ligament because it is attaching the lateral part of the cervix to the lateral pelvic wall. So this is present at the base of the broad ligament, and this is called as cardinal ligament. Cardinal means very important, so it is very important ligament, and this is the lateral cervical ligament from the name, from its position. So we have discussed 4 ligaments. One was broad ligament, then the round ligament of the uterus, then the uterosacral ligament, and we have discussed the last ligament, which was the cardinal ligament or the lateral cervical ligaments. Now what is the blood supply of the uterus? See here in this diagram, we can see the uterine artery. This is the main artery which is coming out from the internal iliac artery, and it is anastomosing with the ovarian artery, which is the branch of the abdominal aorta. So this anastomosis between uterine artery and ovarian artery, they are supplying the uterus. The uterus is also giving one descending branch which is supplying the cervix and the vagina. So see here in this diagram, this is uterine artery, this is supplying the uterus, it is giving one descending branch which is supplying the cervix and the vagina, and here around the ovary there is ovarian artery which is anastomosing with the uterine artery also. Now, what is the lymphatic drainage of the uterus? The lymph vessels from the fundus of the uterus, they drain into the para-aortic lymph nodes. Remember, this para-aortic lymph nodes, they are present at the level of first lumbar vertebra. The vessels from the body and the cervix, they drain into the internal iliac lymph nodes and the external iliac lymph nodes. So remember 3 types of the lymph nodes here. One is para-aortic lymph nodes, then external iliac lymph nodes, and internal iliac lymph nodes. Innervation. Sympathetic and parasympathetic nerves from the branches of the inferior hypogastric plexus, they are innervating the uterus. Okay, inferior hypogastric plexus. Now there is one clinical application which is the prolapse of the uterus. Damage to the supporting ligaments, which are the round ligament of the uterus, the broad ligament, during childbirth or general poor body muscular tone may result in the downward displacement of the uterus. This is called as uterine prolapse. It most commonly reveals itself after menopause when the visceral pelvic fascia tends to atrophy along with the pelvic organs. So this uterine prolapse can occur after the childbirth or when there is a poor muscular tone. So this uterus will be directed downwards and it will project outward through the vaginal opening. So this is called as uterine prolapse. It has many degrees, 1, 2, 3, 4, but you will study in the surgery. The entire uterine cavity can be demonstrated radiographically. This technique is called as hysterosalpingography. See here in this X-ray, one dye is injected through the vagina to see the patency of the vagina and the patency of the uterine cavity and the fallopian tubes. This X-ray is called as hysterosalpingography. Hystero word is used for the uterus. Salpingo word is a word which is used for the fallopian tube, and this is the X-ray. So we will see the patency, whether the fallopian tubes are open or not, or is there any obstruction, just like in the salpingitis or any uterine infection or tuberculosis, we have the obstruction in the fallopian tube. To see the obstruction or to see the patency of the fallopian tube and the uterine cavity, we do an X-ray which is called as hysterosalpingography. Now we will discuss the ovary. We have finished the uterus. Now we will discuss the ovary. Ovary is oval shaped. See here in this diagram, this is oval shaped, almond sized, okay, which is measuring about 4 to 2 centimeters, and it is attached to the back of the broad ligament by mesoovarium. Mesoovarium is the mesentery of the ovary. It is a part of the broad ligament and it is attached through the mesoovarium to the broad ligament. There are two main ligaments of the ovary. See here in this diagram, this is suspensory ligament of the ovary, okay, which is, the name is showing that ovary is suspended through this ligament. It is a part of the broad ligament and it is extending between the attachment of the mesoovarium and the lateral pelvic wall. Here there will be lateral pelvic wall and this is the ovary with the mesoovarium. So this is the suspensory ligament which is connecting the ovary with the lateral pelvic wall. Then there is the round ligament of the ovary, okay, it is representing the remains of the upper part of the gubernaculum and it is connecting the lateral margin of the uterus. See here in this diagram, this is the lateral margin of the uterus and it is connecting this lateral margin of the uterus to the ovary. This is the round ligament of the ovary or the ligament of the ovary, which is also a part of the broad ligament. So these are the two main ligaments. One is ligament of the ovary and one is suspensory ligament of the ovary. Ovary lies usually against the lateral pelvic wall in a depression which is called as ovarian fossa. It is bounded by external iliac vessels above and by the internal iliac vessels behind. See here in this diagram, you can see here above there are external iliac vessels and behind the internal iliac vessels will pass. They will pass behind the ovary. So this is very important relation which you have to learn. The ovaries are surrounded by a thin fibrous capsule which is called as tunica albuginea. Tunica is a word which is used for the layer or covering or capsule, and albuginea shows that it is white in color, which is covered externally by the modified peritoneum germinal epithelium. Okay, so we have discussed that ovary is present in the fossa which is called as ovarian fossa. The external iliac vessels are present above them and internal iliac vessels are present behind them. It is bounded by one fibrous capsule which is called as tunica albuginea. And what is the blood supply of the ovary? The ovarian artery, which is the branch of the abdominal aorta, and ovarian vein which will drain in the inferior vena cava. See here in this diagram, this is ovary. It is bounded by the, or it is trapped by the fimbriae of the fallopian tube. It is present in the ovarian fossa. The external iliac vessels are present above them and the internal iliac vessels are present behind them. Okay, so this is the internal iliac vessel which is present behind them. See here in this diagram, this is very good diagram. This is the fundus of the uterus. This is the uterine cavity. This is the cervix having the internal os and the external os. And this is the vagina. Here, this is the broad ligament which is shown in light blue color. Okay, on one side ovary is shown with the fallopian tube, and on other side the ovary and fallopian tube are cut to show the mesoovarium. So this is mesoovarium which is present here. This is a ligament which is the round ligament of the ovary, or the ligament of the ovary, which is attaching the lateral uterine wall to the ovary. So this diagram is also very important. See here in this diagram also, here they have shown the parts of the fallopian tube and the ovary also along with the ovarian ligament. Now, what is the lymphatic drainage of the ovary? It follows the ovarian artery and drain into para-aortic lymph nodes which are present at L1. Nerve supply is derived from the aortic plexus and they also accompany the ovarian artery. Now we will discuss the uterine tubes. Each one is 10 centimeter long and lie in the upper border of the broad ligament. There are 4 parts of the fallopian tube, which is also called as uterine tube. See here in this diagram, which is a very good diagram to show you all parts of the fallopian tube. First part is called as infundibulum. This is the infundibulum of the fallopian tube. It is the lateral part. It is funnel shaped and it is projecting into the fimbriae. Fimbriae are the finger-like projections which are draping the ovary. Okay, so these are fimbriae. This is infundibulum. Number 2 is ampulla. Ampulla is the widest and the longest part of the fallopian tube, and here fertilization between the sperm and the egg occurs. Then the third part, which is called as isthmus. Isthmus is the narrowest and the smallest part of the fallopian tube. Sometime if implantation of the zygote occurs here, so there will be ectopic pregnancy, and because the size is very narrow and very small, when the baby grows, so what happens, it will rupture and there will be the bleeding occurs in this case. Okay, then the fourth part, which is called as the intramural part, that is the fallopian tube is entering the uterine cavity. This part is called as intramural part. So here we have discussed infundibulum, which is the funnel shaped lateral end. Its free edge has several finger like processes which are called as fimbriae. They are draping the ovary. Then ampulla, which is the widest part of the tube. Then the isthmus, which is the narrowest part of the tube and it lies just lateral to the uterus. And fourth part is the intramural part, the segment that pierces the uterine wall. See here in this diagram, this is the intramural part, this is the isthmus, which is the narrowest part, this is the ampulla, which is the widest part, and this is the lateral part, which is funnel shaped infundibulum, which is ending in the fimbriae. So these are the fimbriae. Here in this diagram, you can see here the anteversion position of the uterus, when the long axis of the body of the uterus is present at 90 degrees with the long axis of the vagina, and when it is more bent anteriorly, then it is called as anteflexed position of the uterus. Now, what is the blood supply of the fallopian tube? It is uterine artery, which is the branch of the internal iliac artery, along with the ovarian artery, which is the branch of the abdominal aorta. They are supplying the fallopian tube also. So, uterine artery along with the ovarian artery. The veins will correspond to the arteries. Lymphatic drainage is from the internal iliac lymph nodes and the para-aortic lymph nodes. And nerve supply is same of that of the uterus. That is sympathetic and parasympathetic nerves from the inferior hypogastric plexus. Now we will discuss the vagina. Vagina is a muscular tube that extends upward and backward from the vulva to the uterus. It is 8 centimeter long. It has anterior wall and posterior wall which are normally in apposition. At the upper end, the anterior wall is pierced by the cervix. See here in this diagram, the anterior wall is pierced by the cervix, which is projecting downwards and backwards into the vagina. The lumen of the vagina surrounding the cervix is divided into 4 fornices or 4 regions. These are anterior fornix, posterior fornix, right lateral fornix, and the left lateral fornix. So there are 4 fornices: anterior and posterior, right lateral and left lateral. The relations of the vagina are very, very important. Okay, the anteriorly it is related to the bladder. See here in this diagram, anteriorly it is related to the bladder and to the urethra below. See here, this is urethra, it is below. Posteriorly it is related to many structures. The upper third of the vagina is related to the recto-uterine pouch, which is also called as the pouch of Douglas. The middle part is related with the ampulla of the rectum, and the lower part is related to the perineal body. See here in this diagram, this is very obvious that upper part of the vagina is related with the recto-uterine pouch or the pouch of the Douglas. Okay, then the middle part is related with the ampulla of the rectum. This is the ampulla of the rectum. It is related to the middle part of the vagina posteriorly, and inferiorly the lower part of the vagina, it is related posteriorly with the perineal body. Laterally we can imagine that there will be ureter which will enter in the urinary bladder. So the upper part of the vagina will be related to the ureter. The middle part is related to the anterior part of the levator and eye muscles, and the lower part is related with the urogenital diaphragm and the bulb of the vestibule. See here in this diagram, this is the uterus and this is vagina, which is shown in black color. Anteriorly it is related with the utrovesical pouch and the urinary bladder and the urethra. Posteriorly it is related with the recto-uterine pouch, the ampulla of the rectum and the perineal body. Okay, now what are the supports of the vagina? The upper part of the vagina is supported by the levator and eye muscles and the transverse cervical, pubocervical and the sacrocervical ligaments. These are the ligaments which are present laterally, anteriorly and posteriorly to the vagina. The transverse cervical ligament, they are present laterally, pubocervical because it is in between the cervix and the pubic symphysis or pubic bone, so it is anteriorly, and sacrocervical which is in between the sacrum and the cervix. Okay, this is the upper part. Now the middle part is supported by the urogenital diaphragm and the lower part is supported by the perineal body. I will show you one diagram where you can see here the levator and eye muscle. This is levator and eye muscle, this is transverse cervical ligament, so they are supporting the upper part of the vagina. The levator and eye muscle, transverse cervical ligament, there will be pubocervical ligament, there will be sacrocervical ligament, they are supporting the upper part of the vagina. The middle part of the vagina, it is supported by the urogenital diaphragm. See here, this is the urogenital diaphragm. The lower inferior layer or the lower layer of the facial layer of the urogenital diaphragm is called as perineal membrane, and the lower part of the vagina is supported by the perineal body. Okay, perineal body will be present here. Now the last subject, which is the vulva, collective name for the female external genitalia and includes the mons pubis, labia majora and minora, the clitoris, the vestibule of the vagina, the vestibular bulb and the greater vestibular glands. The blood supply are the branches of the external and internal pudendal arteries on each side, lymph drainage, medial group of the superficial inguinal lymph nodes, and nerve supply. The anterior part of the vulva is supplied by ilioinguinal nerves and the genital branch of the genitofemoral nerve, and the posterior part of the vulva is supplied by perineal nerves and the posterior cutaneous nerve of the thigh. See here in this diagram, this is mons pubis. This is the lower part of the abdomen having the fatty part or fatty layer. This is the mons pubis. Then there will be labia majora. This is labia majora and this is labia minora. This is urethral opening and this is the vaginal opening with the hymen. This is the prepuce of the clitoris, which is just like the penis in the male, and this is the frenulum of the clitoris. Okay, this is the vestibule and these are the ducts of the greater vestibular glands. Okay, see here in this diagram, this is the body of the clitoris and this is the glands of the clitoris. Here in this diagram, they have shown on one side, they have shown the bulb of the vestibule and the crus of the clitoris. This is the bulb of the vestibule and this is the crus of the clitoris. The bulb of the vestibule is covered by or overlapped by a muscle which is named as bulbospongiosus muscle. See here, this is bulbospongiosus muscle and this is the crus of clitoris which is overlapped by one muscle muscle which is the ischiocavernosus. So bulbospongiosis and ischiocavernosus, they are also present in male as well as in female. Okay, so these are the locations of the bulbospongiosis and the ischiocavernosus muscle. See here, this is the superficial transverse perineal muscle. Okay, because this is the superficial perineal pouch where these structures are present. So this is one transverse muscle which is present in the superficial perineal pouch, and it is called as the superficial transverse perineal muscle. Here posteriorly, this vagina is related with the levator ani muscle. This is levator ani muscle, and it is overlapped by the gluteus maximus. This is gluteus maximus muscle. Here you can see the perineal body, which is the posteriorly the vagina is related with the perineal body and it is supported by it. And here there is anococcygeal body which is behind the anus, and it is in between the anus and the coccyx. So this diagram is very clear to understand the vulva. I hope you understand the lecture. Thank you very much.